Skyrmantas, a senior physician coordinator at the Family Medicine Center in Vilnius, is currently seeing patients in the village of Slatana in the Kharkiv region. The 32-year-old doctor comes to Ukraine for the second time. He worked in Bucha, Irpin, Hostomel and other small villages that were occupied by the Russian army in the first days of the war.
We are traveling through the territories that were under occupation, and I, as a family doctor, treat all chronic diseases. Help is very needed because there are bedridden patients who cannot come to the outpatient clinic for a consultation.
The first from the list of patients with limited mobility in Slatana is Lyubov Kovtun. An elderly woman practically does not leave the house after the operation.
The complaint is such old age, and my legs hurt and my hands hurt, twists everything, well, already 81 years old.
Most patients have advanced chronic diseases, pain syndromes and a poor psychological and mental state. Nurse Vaiva Jankina also participates in a volunteer mission. She says she has been traveling around Ukraine for a year now, helping people in the occupied territories.
It's just that it's probably hard for many to understand, but if people have such a situation that this has been going on for a year already, this war, and they don't have the opportunity to even buy medicines, the pharmacy doesn't work, it's destroyed, the money has run out, the buses don't go, their relatives have left. There are a lot of problems and they really need to come to them and to the same damaged outpatient clinics and even to home. This is one of the central streets of our village. There is a damaged railway station and 50% of the buildings are simply destroyed. On the left, our hospital polyclinic also suffered very badly.
A resident of the village of Slatana, Dobrynya Shebelev, came to an appointment with Lithuanian specialists. The guy is 20 years old, he has a severe disease of the central nervous system and scoliosis of the 4th degree. When the Russian army occupied the village, his parents abandoned him, leaving for Russia. Dobrynya spent several months in Poland and returned to Slatana. He lives alone, his house was shelled. The guy confessed to the doctor that he had no money to buy medicines.
Are you taking any painkillers? I actually need to take medications for the nervous system, but I don't have the finances to buy them, there's nothing.
Dobrynya received a course of necessary medicines for 3 months. This should be enough for the first time, says the head of the local outpatient clinic helping the young man.
He had a broken roof on his house. We have already covered the roof with the help of volunteers. I wanted to take doctors to him, but he came himself.
Thanks to donation from abroad, an outpatient clinic was restored in Slatana. In total, in the Derhachi community, to which the village belongs, 14 outpatient clinics and 5 paramedic stations worked before the war. Now 10 dispensaries have been destroyed, but all family doctors are at their workplaces.
Well, our doctors are heroes, so they work in any conditions. We have gone through all the periods. Potbelly stoves, reception in cars. Now, more or less, we have everything repaired. Yes, we are still huddled in 3 rooms, but all people receive medical assistance. In almost all settlements, family doctors work in full force, in full.
Lithuanian doctors will stay in the Kharkiv region until mid-May, then return to Vilnius. When asked whether they would come to Ukraine with a medical mission again, everyone answered yes. Reported by Roman Smoler, Natalia Belokudria, UATV News.